Do you know what? I think I'll start. It's the 3 minutes past and more people will join, but yes. Good afternoon, everybody. Thank you for joining us. I appreciate that it's sort of an hour or two earlier than usual. They tend to be sort of 5 or 6 in the evening, but obviously today it's at 4. And I can see some new faces as well, so it's lovely to see you all. We're heading towards 800 COVID champions altogether now in Birmingham, which is absolutely fantastic. So thank you so much for joining if you are new to us. I wanted just to take this opportunity to ask you what you would like to see from these webinars. So based on the survey that we did back in January, to anyone that's new, we sent out a survey in January to find out what you all would like really from these sessions and what you'd find useful. And some of the feedback was to cover mental health and bereavement supports, and to think about and I guess give you like a better understanding of the support that's available to children and young people during this time as well. We've got those planned over the next few months. I don't know if anyone wants to put their hand up or pop it in the chat box, things that you would like to see in these sessions. There is no right or wrong answer. Please feel free to be honest. But yeah, it'd be lovely to get some feedback from you. If you want to pop your hand up, or like I say, pop it in the chat, please feel free. But it'd be great to get some feedback. Hi, Peel. Hi.
Hi, Holly. Thank you. Yes, good to see everyone. I'm sorry I haven't been able to join in previous meetings, these webinars, but I am a long-standing community champion. I don't know if I've done anything yet, but we've been helping with the distribution of food parcels to individuals' homes. So I've been doing that weekly with the Active Wellbeing Society. But in terms of these webinars, I think perhaps we can also look at how people from different institutions, maybe different communities, different faith groups, etc., and other non-faith groups as well, can do something together, maybe 3 or 4 different institutions, to target really those communities which are lagging behind in terms of getting vaccinated, while at the same time they are at greater risk than others. I'm thinking of Black and minority ethnic communities. The risk is higher and the take-up is lower, so it increases the risk many times. So I would really like us to think of ways in which we can work together to encourage people to get vaccinated.
That's really helpful feedback. Thank you so much. I just want to just nip into the chat box as well. So Claire's mentioned about doing a session on long COVID. That has been actually on our radar. I think that would be really useful. I think it's also part of like the COVID recovery as well. People may have had COVID, but yeah, some people are still suffering and perhaps will do even after the vaccine rollout. People are vaccinated, so that'd be a really good one to cover. I'll definitely write that down, Claire. That's really good. Alison, do you mind? You've put in the chat box how to start to reopen safely. If you feel comfortable, do you mind perhaps coming off mute and perhaps giving me a bit more information? Is that businesses, residents, schools? Yeah, just what sort of information really is that you'd be after? That'd be really helpful. If you don't want to, oh hi Alison.
Sarah, can you come off mute and just say what I was thinking about that?
Yeah, we work. We're a charity in Harborne, a day centre, and we have adults with cerebral palsy, and it's just, I guess, one of the most important things to us at the moment is how we reopen our service to a vulnerable group of adults who have got disabilities, cerebral palsy, in the most safe way, really. I wondered if there must be other day centres and services like ours as well, if that's a topic that you could perhaps cover.
Absolutely. Thank you so much for raising that. I've got that written down as well, so leave it with me.
Thank you.
It might be perhaps, I'm just trying to think, we probably would need to involve other teams as well, but if we could do a session for this audience, that'd be really useful, I think.
Brilliant.
Sue's put just general up-to-date information and any specifics that my local community contacts need. Sue, again, do you mind coming off mute? Do you mind talking about where perhaps you are from in Birmingham, just to give us an idea?
Yes, hi. I'm from the sort of west side of Birmingham, but my contacts are very much similar to Sarah. Got a lot of youth centres that are around, so they are wondering how they might reopen to the future now, particularly that schools are open. And also, I've got a fairly large church congregation that I'm in contact with. So again, what will happen to them? So similar idea, really. It's how to reopen. But I am sort of spread out quite across the city with different groups.
No, I appreciate that. Thank you very much, Sue. And I've put down one for faith setting as well. So I think that would be really useful.
Yeah.
Your second point as well around promoting the vaccine rollout. I don't think they're on the call today. I'm not sure if you've joined our webinars before, but we tend to have the CCG join us, and they'll give us an update on where we are with the vaccine rollout, how many people in Birmingham have had it, and just general sort of issues that are worth you guys knowing about, so you can let communities know and that sort of thing. And we do have a session planned with them soon, so I can let you know when that is. And I'm just checking actually if they're on the call. Bear with me. Oh no, they're not on the call today, but I can let you know when the next one is.
That would be useful. We are getting queries with regard to second vaccinations, particularly with the news the last couple of days, and people that actually haven't got dates. So they just expect within the 12 weeks, but now they're worried that they're not actually going to be called.
Okay, I think some of that might be covered today actually. So leave that with me. If not, I can definitely speak to you outside of this session to give you the information.
Okay, thank you.
You need. So Benita says that BVSC and adult social care are looking at building risk assessments and ongoing guidance. That's really useful to know, Benita. Thank you for sharing that. Oh, and it's actually attached in the chat as well, so that's amazing. Does anybody else have any other topics I'd like to be covered before we move on?
I'll just point one out that you might have just slightly overlooked there from Claire, who says that I'm assuming by the profile name that she's something to do with long COVID, and that she'd be happy to speak about it or in the future. So perhaps we could link up afterwards and sort something out. Or if we've got time at the end, maybe Claire, you could have a say on the matter.
Yeah, happy to speak. Thank you.
Yeah, that'd be great. Are you here until 5 o'clock, Claire? Would it be okay to perhaps do that towards the end, or if you want to do it now,
yeah.
That's no problem.
Whenever suits you.
If you want to perhaps have a little slot now, that'd be amazing. We'd love to hear what you've got to say. I'm
actually still in my pajamas, so apologies. That's the life of long COVID.
Honestly, working from home is great in some ways, but yeah, it's absolutely fine, Claire.
So I live in Kings Heath. Yesterday was the anniversary of me falling ill with long COVID, so I found a rather tough milestone, I have to say. My 3 children also have long COVID. I set up a Facebook group in May last year, which now has over 37,000 members in 100 countries and growing all the time. Wow. We share information and support. We have Zoom socials. We have sort of events, things like chair yoga and breathing and all sorts of different useful things. Our website is a little bit out of date. My friend updates it on a voluntary basis and is rather busy. But we're adding resources all the time, and it's flattering that lots of people in the health profession refer people to our longcovid.org website. Well, it's flattering and also alarming that our site is deemed more useful than the NHS information, which frankly it is at the moment. And yeah, the long COVID it's incredibly complex in terms of the presentation. It can impact anywhere in the body. I think there's a huge issue with a lot of people not being aware that they've even had COVID, because if you Google NHS COVID symptoms, you still get cough, fever, taste and smell, which most people don't have those symptoms. My 3 children have never had any of those 3 symptoms, for example, and that's not unusual in our group. So I think and you can also get long COVID if you've been asymptomatic in the early stages of your illness. So I think there's probably an awful lot of people who are absolutely alarmed, frightened, not aware of why their bodies are doing incredibly frightening things. I'm unable to walk. I now need a wheelchair to leave the house. I used to cycle 13 miles a day just over a year ago into town on my commute, and I now also can't work. I can't do my paid work anymore because I can't concentrate enough. So I'm not quite sure what the future holds. Thankfully my employers sort of they're supportive, and they're trying to see if there's a role that I could possibly do, but it's going to be a massive pay cut, whatever it is, even if I'm lucky enough to do anything. So it's severely debilitating. I think it's shone a huge light on health inequalities. I think at the moment, because we're a bunch of ill volunteers, we have been very focused on Facebook and on our website, but I'd really love to get more involved in outreach, maybe through social prescribing link workers, people to signposts. And as the economy opens up, I'd love there as Altists to set up kind of more face-to-face, you know, maybe meet up in a cafe once a month, because we have really, you know, our members tell us that their mental health has been sort of the only thing that's kept them going is our group, frankly. So they need to connect with other people going through this is enormous. People that don't get it unless they're going through this. So yeah, I think education is really important, because there'll be, as I say, loads of people who will have no idea what's happening to them. And then signposting as well. So that's a bit of a whirlwind. There's all sorts of angles. There's people have been, you know, I was turned down for my personal independence payment disability benefit. I've appealed, so we'll see what happens. But I know lots of people in our group are unable to secure benefits. They're losing their livelihoods. We need it to be recognised as a disability under the Equality Act, because people are being forced back to work, and sometimes hauled up in front of tribunals for absenteeism through no fault of their own. Yeah, income protection schemes aren't paying out because it's not recognised as a critical illness. I've applied for a blue badge. We'll see if I get that, but it's because it's a new condition. It's very poorly understood, and the systems aren't there to catch us. Yes, seen in the chat, someone said that vaccination can help. There's a certain proportion of people that it can help. I've not been lucky enough to be offered a vaccine. I was hoping that I'd be deemed vulnerable enough to need one, but I haven't. The answer's been no for that. But yes, certainly some people are seeing an improvement in symptoms, but equally others are not, and indeed a worsening in symptoms. So it's potluck, I think. But thank you for the opportunity to speak, and I'm very happy to meet with anybody at any point to get the word out. Our website is longcovid.org, and my email is claire.hasty@longcovid.org if anyone wants to reach out.
I just want to say thank you so much for sharing that. I actually feel quite emotional hearing that. You know, we hear a lot about long COVID from a public health perspective, but to actually hear someone's account, it's really powerful. Thank you so much for sharing that.
Thank you.
I think it would be really useful, because obviously some people perhaps in Birmingham will be part of this Facebook group, but they might not be, and you know, they might really benefit. If we can perhaps do like a little feature about this in our weekly newsletter,
I would love that. I would absolutely love that. And I think I had the thought the other day that maybe with it being the end of the financial year, there may be some bits and bobs of budget sitting around somewhere that might not get used. And so if there's any way that could be used to, as you say, I'd wondered about the weekly newsletter. I didn't really know who to contact about it, but I would really appreciate that. I
think I've got your email, Claire. If you're happy for me to reach out to you, let's have a conversation offline, because I think there's a lot we can do here. And I think also in terms of these webinars moving forward and the topics, I think it would be great for us to have a session on long COVID, what that means, what help is out there. Obviously someone raised the question in here around how the vaccine can help some people, even perhaps getting an expert in to just have a chat with you, and just to share the latest evidence and advice. That would be
we've got some evidence and advice. We work a lot with researchers because we're the biggest we're the biggest group of our type in the world. So we in fact helped to co-organize the first international research conference on long COVID. We helped to co-organize, and we had the Director General of the WHO came and opened it. So because research is yet to catch up, we are kind of experts through experience, and people thankfully do reach out to us a lot, and we're very happy to help because we're just desperate to help people. And there's all sorts of knock-on effects. So I've had a message from someone today just before this call, in fact, who lives in Yardley down the road, a member of my group who's been diagnosed today with breast cancer, which she believes is related to her COVID, but she's not able to get treatment for that because of her dodgy heart and her dodgy lungs, which are being also treated and caused by COVID. So, and what we don't know as well is what we're storing up in the future. So are we more susceptible to strokes or heart disease or whatever in the longer term as well? So there's all sorts of things that are just not known, but it's the pandemic on the pandemic. The ONS figures, they say 10% of cases can have long COVID, or have symptoms at 12 weeks, but they recognise themselves that those data are understated because that was based on asking people about 12 symptoms. They've since updated the question to cover 21 symptoms, but research has shown there can be over 200 symptoms. So it really is it's an understated problem. It's enormous, even with the ONS figures, but I think they could be double that figure. So yeah, thank you for the opportunity to speak.
No, thank you so much, Claire. And I'll definitely speak to you offline if that's okay. Yeah,
brilliant. Please do.
Definitely see an opportunity here.
I think I'd just add to that as well, that sort of reconfirming what you were saying there, Claire, about the uncertainty. I think we're constrained obviously by what Public Health England say and what the NHS say and things like that. So you might feel, some might feel like it's slightly delayed what we're putting out, or it's not quite as well furnished as what you're putting out. But I think just so that everybody is aware that what we're saying is going to have to be in line with Public Health England and the NHS. So just so that everybody's on the same.
I sit on the NHS England task force on long COVID and the Department of Health, Lord Bethel's monthly roundtable, but I don't have contacts at Public Health England, so I guess it's in the middle of being disbanded, is it? Yeah, I don't know. But oh, sorry, have I said something controversial? I thought it was being abolished. No, maybe that's just, I thought I'd read that in the press ages ago that they were going to change it and make it into a new agency.
I was only laughing about the timing of it, Claire, and how ridiculous it is, but that's my own individual view.
Well, yeah, and they're obviously restructuring the NHS as well, just to add anything. But so yeah, if there are people here who have contacts at Public Health England, that would also be helpful. We're just trying to get the word out to help people.
Yeah, of course, yeah. It's just so that for the benefit of other champions, just so that they understand that, of course, it's what we actually say is going to be in line with Public Health England and the NHS. So if they feel like they would like to explore the subject, then by all means, but we are going to be constrained by what their messaging is.
Yeah, understood.
Thank you, Jack. Madupa, you've got your hand up.
Yes, I was going to firstly echo Holly's comments to say thank you very much, Claire, for sharing that. And I did struggle to remain, calm. It's very moving, your story. And I don't think anyone could have told it like you have. And it's such a privilege to be here and hear it firsthand from you, because, as public health professionals, we read a lot of stories, but, when you hear it firsthand, it's not the same as when you read, and you can hear from your voice and even the expression on your face, which you can't see. I don't know what I can see myself, but I'm looking at you, so I'm not. You perhaps weren't looking at your face as you spoke, and it just came across really strongly, the passion and the reality of your every moment of every day. There are a couple of updates that we've been getting. I think, firstly, to clarify that most of the information on long COVID at the moment is being driven by the National Health Service. And that's because Public Health England, you're right, is moving on. But their primary goal at the moment is to try and continue to try and contain or sort of control the spread of COVID-19 with all the new variants and everything. So the National Institute for Clinical Excellence, NICE, last October published guidelines for long COVID, and that was very welcome, because once NICE starts to talk about guidelines for a clinical condition, that's a sign that people are listening and taking it seriously. So if it helps at all, I think the NICE guidelines is a step in the right direction. And I think the 69 research centers, which are like hospitals that are now available to people, and usually, if I remember, it's via a GP referral. And I don't know, it would be really good, as Jack and Holly have said, if we met with you, because what we would need to understand from your perspective is how easy it is to get a GP to refer you to those 69 centers, because that's where I would want to be able to see that process is working, that the GPs are able to work with the guidelines they've received from NICE, and each GP feels empowered enough to be able to say, okay, I'm looking at the situation here, I'm listening to my patient, and I can see here a need to refer to the 69 centers. And we're not sure what that referral process is, but when we meet with you, perhaps you'll be able to tell us a bit more about your experience there. Maybe some of our comms could be Holly, around that. Once we, as Jack said, once we know what we know, because what we don't want to do is put information out that's misleading and causes more anxiety, because this whole forum is to try and help everybody. So I thought I'd mention that because that's something that I know started quite late last year, October, but it's definitely work in progress.
Well, it's actually December. The NICE guideline and the clinics came out on December the 18th, actually, and we have an ongoing survey of our members that they complete when they try to seek referral to these services. And the figures are really quite stark. The vast majority of people are unable to get a referral from their GP, either because their GP still doesn't believe them, even though the NICE guideline has come out. Because then I've got lots of issues with it's welcome that there's a NICE guideline, but there are lots of shortcomings with it actually. And so it's so difficult to diagnose. There's not very much practical, actionable evidence in there for the GPs and clinicians to follow. So a lot of people are not being believed still. And also the pathways that you talked about, the referral pathways, are incredibly complex and convoluted and not known. And some of the clinics on the list don't actually exist because it turned out that they decided not to open yet because they were too busy with the acute cases. Others do exist, but the GP doesn't know how to reach them, or the GP might refer, but then the clinic says, no, actually that person hasn't been ill long enough. There's like any number of reasons why, but there are huge barriers. And so we do have ongoing data, and we try to collect it by, we ask for people to put in their CCG if possible, so that we can slice and dice the information. So we should be able to cut that in a way that's useful for this area. So again, if someone wanted to follow up offline and work out exactly what the regional split should be and the best way to give you answers meaningfully, then I'd be very happy to do that.
That'd be amazing, Claire. I'm really looking forward to meeting you properly. Thank you so much.
Thank you.
So usually, I don't know how many new champions we have on this call today. We tend to have sort of themed sessions, and then sort of every 2 or 3 we have more of a general session where Public Health will give you an update and you can ask any questions that you like, and we'll do our best to answer. I've just noticed that before we move on to that, we have Rizwan on the call. Hi Rizwan. Rizwan works at the CCG. He is a GP and works very heavily with the vaccine rollout. Would you like to give us an update on that, Rizwan, since you're here?
Yeah, I'm sorry I'm late. I was stuck at a vaccine center, believe it or not. We had a few extra patients, so we had to extend the session. But the good news is that on the vaccine rollout, things are going quite well. Obviously, you may have heard regarding the batches of AstraZeneca vaccines, which need a little bit of further investigation. So therefore, we're anticipating a little bit of a shortage or a shortage of supply in the coming month of April. But so far, we have got plenty of vaccines, and things are going as they should be. The good news also extends to the fact that we've now started our mobile vaccination units, which was targeting areas of low uptake. But areas particularly such as Small Heath. We had a clinic today at one of the mosques there at the Jamia Mosque on Coventry Road. We vaccinated about 50 people, and at prayer time, at the afternoon prayer time, it was actually quite interesting because a lot of people were quite curious, looking and peering into the vaccination van and thinking, maybe I should get one. And then we have now made a pledge to have another session in 2 weeks' time, hopefully with a few 50 other patients booked in. And I think the same happened last week at the Isa ibn Maryam Mosque in Hall Green. And there are lots of other mosques and churches and community centers which have been lined up, including gurdwaras and temples, which hopefully should be coming online in the coming weeks. So really, that's as far as the vaccine update is concerned, things are going as well as they should be, to be fair.
Thank you. And so I just want to clarify as well. So if we have the pop-up vaccination sites, for example, at a mosque, am I right in thinking that anybody can book and use them?
Yes, absolutely. In fact, what happened at the Isa ibn Maryam Mosque was that not only the people from the mosque themselves turned up for the vaccine, but people in the surrounding areas who were living around the mosque also came in. And what we found interestingly is the clinically extremely vulnerable groups, who were shielding, who maybe had hesitation about going into general GP practices and mass vaccination sites because of mingling with too many other people, actually elected to come to these sites because they were much more smaller and a little bit more sort of petite. So actually, anyone is welcome. The mosques and the temples and the churches are advertising on those bases as well.
Thank you. And we I think as in the update last week, we included the latest sort of pop-up site, if you like. We'll make sure that we keep including those in the update every week. So if you know anybody in your community or the site happens to be local to you, please get the word out and get try and encourage people to get booked on.
Yes, absolutely. So any area, you don't have to live in the local area. You can go to any pop-up site if you wish to. It's a wonderful experience. I really thoroughly enjoyed my day there today, to be fair. The community made us feel very, very welcome. And to Beatrice, Imelska, Yardley, Stetchford, we have had very good coverage, but whilst we're doing it in Small Heath, people are welcome to come there. Hello, Beatrice, you're my patient.
Thank you for answering that. I don't know if you can talk about this or not, and we haven't had anybody ask this, but I think it's quite important. Obviously, we heard in the news, do you know what? Yeah, I think it was yesterday, around the shortage of the vaccine in April. Are you able to clarify? So if anyone's got an appointment in April, they're okay. Is it for new bookings? Can you just perhaps give some advice to the champions, if you will?
Yeah. So I think the delay will be, or the effect will be in that the 50-year-olds and above that we are vaccinating at the moment will be slightly more staggered than what at the pace that we hope to be. But the second doses are not affected. If you've already got a booking, those are not going to be affected, because we know we're getting to the 12-week period for those who were vaccinated in January. It is a priority for us to get those people in for their second doses as well. So we are working through the priorities, and it will just be a little bit more staggered and a little bit more slower in those people getting their first doses, particularly those around the age of between 55 and 50.
Thank you. Yeah, Julie's put, I'm worried as I've had my first jab, but don't have my appointment for my second jab. Others have asked me about this also.
It is coming. Believe me, the problem is that GP surgeries only get told the week before when they're getting what doses they're getting in terms of AstraZeneca or Pfizer. Now, a lot of people will have had their Pfizer doses initially during the December and January time. And we can't give you a date until we know that we're getting the Pfizer vaccines, because obviously we're getting a lot more AstraZeneca vaccines than the Pfizer ones. So definitely we've got everything earmarked, and we've got lots of alarms and stuff on the systems letting us know that people are getting to their 3 months, and you will be called. It will be probably around the 3-month time. It won't be any earlier, but you will be getting the vaccines. Don't worry.
Thank you. And Shakil's actually asked a really good question. I was going to ask something similar. So this week we've had quite a lot of people sort of perhaps say, oh, I know somebody that had perhaps not a very nice side effect to the vaccine. And I know it doesn't happen very often, but sometimes it can happen. And people were looking for advice on, what to say to these people. If they're perhaps now worried about getting their second dose, what can I say to help them? And Shakil in the chat has put, can someone have a different vaccine compared to their first and second dose? Can you talk about that perhaps a bit more, Rizwan, as well?
Yeah, so I think at the moment, the guidelines are that you have the same vaccine as you had as your first dose. So we're not mixing and matching the vaccines at all. I believe there is a study going on around about the mixing and matching of vaccines. We do not have the results of that just yet. And there's also a study going on about whether one dose of vaccine is effective as well. So I think there's a lot of different permutations, but at this point in time, as we speak, those who have had their first vaccine will have the same vaccine as the second vaccine at a 12-week period.
Okay, thank you very much. Does anybody else have any questions about the vaccine before we move on? No, I mean, if you do at any point, please.
I think we did get one from Beatrice, who was asking about Stetchford and Yardley. Not quite sure exactly what to do with. I think it was the vaccine at the time, unless Beatrice wants to come off mute and expand.
I think that one might have been answered. That was around the pop-up sites. Is that correct, Rizwan?
I think I assumed it was regarding pop-up sites in Stetchford and Yardley. Stetchford and Yardley, we've done quite well, actually. So we haven't needed a pop-up site as yet, because people have been quite happy to go to the the local site of their radiomedical practice. So I think we've been okay. But obviously, it doesn't exclude them from coming to the nearest pop-up sites in Small Heath if they want to.
Thank you. We've had a couple of questions. One from Mike. Is the second vaccine the same as the first, or is it a different strength?
No, it's exactly the same. We'd like to keep it simple. We're very simple people.
Thank you. And one from Julie as well. Are all the appointments being filled?
Yes, in fact, we're getting more than what we. So today, for instance, I had taken 50 vaccine doses, and literally at the afternoon prayer, when the curiosity kind of, when the curiosity got the cat, it got to a point where I needed to probably go and get a few more doses, but unfortunately, we ran out of time. So yes, that we're doing more than what we need to do, to be fair.
Thank you. David Hickman has asked a really good question. How effective is the second dose of vaccines? Now I know, one dose will give you some protection, but that second dose will give you, more protection. You always want to go for the 2 doses, but can you shed some more light on that as well?
Yes, of course. So Modopi is probably more sort of qualified in this, but I'll give you my amateur view.
Yeah. We could do a tag team.
Yes,
Please
absolutely.
feel free, both of you. Sorry, Modopi.
No problems, right?
I think your first dose is going to cover you for up to about 70% protection. And your second dose is a booster dose. So essentially, it gives your system another revision, essentially, of what they need to protect against, which is the spike protein of the coronavirus itself. So it takes the effectiveness up to about the 85, 95% sort of effectiveness.
Thanks. There's some follow-on questions as well. So David says, can you still get COVID if you've had the second dose? I don't know, Modopi, if you want to take that one, please feel free.
Happy to. I think you can still get COVID even if you get the first dose. So the vaccines which we currently have been shown to stop you from getting what we call severe illness from COVID-19. And we're very grateful that we could actually get these vaccines out quickly enough. I think it's because of the ongoing work that was being done actually by the pharmaceutical companies to produce these vaccines prior to this pandemic. So it's a good example of what happens when we come together and work together, just as we're doing now, and people work together to do something good for humanity. So we know that you can still get COVID, but we know that we won't be having lots of people in hospital or sadly dying like we had in the first wave, and I don't know how many waves we've had now, but that's the thinking behind it. So it's one of the reasons why we still have to keep testing people. We still have to keep washing our hands for at least 20 seconds. We have to wear our face coverings when we're in public places. Once we know where we're going with the lockdown as well, if we do end up being allowed to meet indoors, we have to make sure we're opening our windows now that the weather is better. Good ventilation for those of us who perhaps work in the offices. We'd like you to be championing good practice in workplaces for us so that people are following the rules, and then obviously the social distancing, which has been very difficult because we haven't been able to go and hug each other like we would normally. And I know a lot of people have been affected. I go out sometimes, and because I've got my face mask on, I forget I'm smiling at someone and they can't see my smile. So it's been extremely difficult for all of us. But for now, we're grateful to have a vaccine that stops people from being in hospital or sadly dying. But at the moment, there's more research going on to see how much it stops us spreading the virus if we did get the virus after the vaccine. The other thing to bear in mind is that just because we have these vaccines doesn't mean that's the end. If you go onto the World Health Organization website, there's still loads of vaccine candidates, as we call them, in development. There's more research being done to see how we can improve on this, because it isn't a sprint, it's a marathon. We haven't had a pandemic like this for a long time. And what we're learning from this pandemic, someone mentioned earlier about inequalities and different things, is that we do need to look after those of us who are perhaps a lot more vulnerable than others, the elderly and the people who have been most affected. So we must keep doing what we can, as the experts advise, take the vaccine, but still be mindful that there's more work being done to strengthen all that we know about COVID and the COVID vaccines.
Thank you, Modupe. I guess this also ties in quite nicely with Shakil's question. Why do people need to cover their face if they've had the vaccine? I mean, having vaccines, great. It means that you are less likely to be hospitalized or perhaps even die from COVID. The studies are showing that you may transmit the vaccine, the virus, less if you've had the vaccine. But it's not necessarily proven yet, which is why you would still need to follow the guidelines. Still wear your mask, still wash your hands, still socially distance. Do you want to add anything to that, Rizwan?
Well, actually, yes, because the new strains which we are looking at is actually showing that 1 in 3 of us is going to remain asymptomatic. So we will have no symptoms whatsoever. So even if we are vaccinated and we've had a very mild illness because of that, we are still going to be shedding the virus. So it's about I don't know about whether you guys follow Facebook or not, but I do. And then there is a cartoon about 2 people urinating at each other and with the trousers and without the trousers. So it's really, that's the same analogy in the sense that the spread with the mask is much more limited than otherwise.
Thank you. Denise has asked, will the side effects be as bad with the second vaccine? So I presume, I don't know if you want to perhaps come off mute, Denise. I presume perhaps you had a side effect maybe from the first dose. Rizwan, will that mean that Denise will have the same for the second, or is it not that simple?
Possibly. The thing is that at the end of the day, a vaccine has got side effects, but thankfully they're very mild. You will have a bit of an arm ache. You may have a bit of a fever or a headache for about a day or two. And a lot of this is going to get better on its own, but if you need to take some paracetamol, then that should be absolutely fine. There should be no problem there at all. So the side effects may be the same with the second dose, I'm afraid.
I did have quite bad sickness for a couple of hours with the first one. So, that was quite unpleasant, as well as the flu symptoms. And it's just the thought of going through it again. But
I mean, to be fair, you can, Denise, speak to your GP if it is becoming if it becomes very difficult. They may be able to give you some anti-sickness medication, or a bit of ginger and herbal remedies may help as well.
Lovely, thank you.
Gary, thank you, Denise. Gary has said, if you've had COVID and made a full recovery, can you catch it again? Modupe or Rizwan, I don't mind who wants to take the question. Sorry.
Shall I have a stab at that one? And then Rizwan, please come in, because I haven't looked at the reinfection, what we call reinfection studies, which I think started from perhaps was South Korea, who first had. And it's interesting because this coronavirus, we've had coronaviruses before, and we've studied coronaviruses for a long time. But in spite of what we know, the viruses tend to be quite clever, and they dodge and they do funny things. And I think this is a really good question, because it's one of the things that we learn about this coronavirus. And there was a study that Public Health England published recently called the Siren Study. I don't know where they come up with these names. I quite like that one because I remember it. It's siren, like headlamps, the headlights of the police and all. And it talks about people that were observed over a period of time who appeared to have developed immunity to COVID-19, so being reinfected for about 5 months if they had been infected the first time. And if you remember last year, there was something they were doing called the antibody testing. There were particularly people who worked in the health service were being encouraged to give blood to test to see if they had developed antibodies to protect them from getting COVID-19 again. So we think that a percentage, and I'm not going to say it off the top of my head because I can't remember now the rough figures that were projected. The percentage of people might not get COVID a second time, and some will. And the ones who do, again, it's very hard to say whether when they get it the second time, they get more unwell than they did the first time. Because as Rizwan said, some people don't even know that they have COVID. 1 in 3 people at the moment do not have any symptoms. So the simple answer to that is that yes, you can get COVID the second time, we think. And we think if you've had it the first time, we don't know again who does and who doesn't. You might be able to develop immunity for about 5 months. And then after that, you might still be exposed, or you could develop the infection. You could be reinfected again. There are a lot of unknowns, but the beauty of it is that we have the vaccination program running now, and more people, I think about 20 million people in the UK now have had that vaccine. And the more people have the vaccine, the less worried we would be about what would happen if people get infected. We hopefully will not have the kind of scenes we had on the television of the hospitals and the NHS struggling to look after people who are extremely unwell. So I think reinfection is a big question, and it's a big unknown, except Rizwan has more facts than I do. But altogether, we've said before, the ways to stop this happening are those simple things that Holly ran through again, which is the washing of the hands, and those things that just help us to protect not just ourselves, but each other. Some of us live in households with older parents, or people who are clinically extremely vulnerable. We're doing it so that we can look after our families and our neighbors and people who we love.
And I think perhaps to add here is that I remember Justin saying this a while back, that the response to COVID-19 infection is very variable within different patients. And we found that a third of the patients actually did not make or made very negligible amounts of antibodies, whereas a third made a good response antibodies, but it may last for up to 6 months or a little bit longer. So I think it's a bit hit and miss, if at the best of times, to be fair. Therefore, I think it's not as reliable as the vaccine, which we know elicits a better response with antibodies.
Thank you to you both. I think I've looked in the chat box, and I don't think there's any more questions about the vaccine that are still outstanding, but we have got a couple of questions around testing. So Alison Lilly has said, can someone tell me if businesses should be using PCR tests for their staff or lateral flow tests, and what are the main differences between the two? Madupe, do you want to take that one?
Yes, thank you. I didn't get the first part of the question. Oh, businesses should be using. Okay. So the PCR test, I'm not going to try and attempt to remember what PCR means. It's polymerase something reaction. Chain reaction, that's a test. I gave up saying that word a while ago. It's a bit of a tongue twister. So that test actually is the most effective, as we say, or the best at detecting when people actually have COVID-19. It's more sensitive, as we call it, to picking up the infection. The thing about it, though, it takes some time to get the results back, because it's got to be processed in a lab. And what we found at the beginning of the pandemic is that it was taking our laboratories a long time when we got to a point to process the tests, because of the sheer number of tests that were going out then, primarily in the health service and in care homes. So, people who perhaps know a bit more, who work in care homes, will know that they've been doing weekly testing for a long time, I think since around May. So the labs do other things apart from COVID-19 testing. They test for other infectious diseases. So the pressure on the labs meant that we had to get to a point where we could get hold of what we call the rapid tests, which are the lateral flow device tests, which are a bit like a pregnancy test. You can do it yourself. It's like a DIY test. You pick it up, you do the swab, and you wait up to about 20 minutes, and you'll know whether you're positive or negative. The difference, though, is the lateral flow device tests are not as sensitive as the PCR tests, meaning they're not as good as picking up when you have the infection, unless you have a high viral load, in which case they're very good, because when you have a high viral load, the evidence suggests that's when you're most likely to be what we call a super spreader. We don't want to label people, but that's when you're most likely to be actively spreading the infection. So there is a place for both tests. And what we found now is that because of the pressure on the laboratories, because also we want people to be able to quickly make a decision about, am I positive, am I negative, can I go into work, can I go into school? By making the rapid lateral flow device tests available, people can check their almost COVID status before they make a decision about jumping into the car and going to work or going to the shop. And then they can isolate if they have to. And their households can isolate as well. So the only thing to bear in mind that there is no test that is 100% accurate, and not just COVID. I think any diagnostic test has a margin of error, as we call it. So we do say that we don't rely solely on a test result to inform our behavior. Just because I got a negative test result doesn't mean I can then not wear my face mask and go around, because it might just be that it's negative at that point because I haven't got enough viral load, as we go. We haven't replicated enough virus. I haven't built up enough virus in my body for the test to see at that point that, hang on, Majupe, you have got COVID-19 or you've been exposed to somebody with COVID-19. So we must use the test with a bit of caution. So the businesses should be using the the lateral flow device test in the first instance, because it's quicker and it's less pressure on people waiting to find out whether they have the test or not. But the fact that you get a negative lateral flow device test doesn't mean that you haven't got COVID for sure. But if you did get a positive lateral flow device test, you then have to apply for what we call a confirmatory PCR test. And all those are now much easier to apply for online. And whilst you're waiting for that result, you should isolate yourself and the people you live in, just in case someone in your household has been exposed. So the main difference is really is just the time it takes, the fact that one test is more sensitive than the other, and that sensitivity is why you have to do the PCR test afterwards, because what we don't want is people who have had a positive LFD test who, and this is where it gets a bit more complicated, who perhaps actually are not positive for COVID-19 necessarily. So they're not necessarily infectious. Perhaps they've had COVID in the last 90 days. I'm sure some of you have heard about that now, just isolating when they don't actually have COVID-19. So there's now a lot of emphasis on, just because you get an LFD test that's positive, if you got a negative PCR, you don't need to isolate, because your negative PCR will trump your positive LFD test, because the PCR test is far more sensitive. So it's not, doesn't mean the LFD test isn't good. It's just what they're both doing and the purpose they both serve at that point in time. We can do a bit more about this perhaps through the, I'm just thinking as Holly and Jack, through the social media pages, because I think this comes up quite a lot. We've seen quite a lot of questions like this from the schools as well, since the children went back last week and families have had to do more testing, just so that we can break it down a bit more to all our champions as well as your communities.
Yeah, that's something that's regularly in the champion updates, the email updates. So there's plenty of links in there, and it always goes to the Birmingham City Council website where you can find out what you need to do, as well as the NHS stuff. But we can give it another push as well, because obviously there's a lot going on with schools and things like that. So yeah, we can do that next week.
Thank you.
Thank you. That actually is funny that you mentioned schools. So Claire has asked, when will we see the data on the impact of schools opening on transmission? I don't know if you might know when that might be, Madupe.
So we have actually, that's a really good question. And I think it's nice to know we're all singing from the same hymn sheet and all working in the same direction, because just this afternoon, I had a conversation with the education lead in the council. We want to send out a survey via the schools to parents, firstly to find out what kind of experience they're having to add doing LFD testing to the school runs, because I've got a 14-year-old and I could tell you, it's bad enough getting them out of bed in the morning and then doing an LFD test before school. So we want to find out a bit about those sort of practical experiences and see if people can share some tips on how they do it, because I know, for example, some schools have asked teachers to do the test the night before, so that you're not waking up in the morning and finding out, you got positive LFD and panicking about how you're going to manage your students on that day. So there's some of that going on. And then I think the work around transmission and how the research, so it's not something we've planned to do in Birmingham, because that's usually a bigger piece of work, which tends to be led by the Department of Health and Social Care and Public Health England. And what they do is they collect all the data on the testing. So at the moment, when you do an LFD test, I didn't mention it earlier, there's now a space on the government website for people to go and record the results. So even though you're doing it at home, we trust people to be able to go on that website and say, I've done my LFD test today and it's positive or it's negative. And all of that information is now being socked centrally for analysis to be able to see how good those tests are. So we will be able to hopefully measure that against the transmission rates in the schools. Not just here in the city here, but across the whole of England, to say this is really working and we can carry on doing this for another 2-3 terms. And the other thing that they're doing as well, apart from checking that, is trying to see whether there are other options apart from isolating the children to try and minimize the disruption, to school, because we know it's been very difficult, particularly for children and young people. So, the bits around the research, I think for us, those of us in the local public health teams, our main priority is trying to just exactly what we're doing now, keep everybody motivated and going, because it's a long haul. This isn't going to be something that's going to be over very soon, very well, not overnight anyway. And I think Holly's mentioned earlier that we have about 800 champions, but we want to be able to get more people on board, particularly in the groups where we haven't got enough people, the younger people, men. We need more men to come on board. And so, we want to be able to do research and see how it's breaking transmission and all of that. But oftentimes doing that at local level can distract you from the real practical things that make a difference. So that data is all being shared with PHE, and hopefully they will be able to give us an idea over the next perhaps couple of months about how they think this is all making a difference for us in the schools. And just to add before I sort of close that particular question, is that apart from the testing in the schools, you will have seen that the secondary school children are wearing face masks as well. So as we said earlier, it isn't just testing. We're encouraging them to wear face masks. We're encouraging the bubbles and all those things that we know come together to help to reduce the risk of transmission.
Thank you, Modupe. Benita has sent a really good link, and I'm really pleased that you've done this, about workplace testing as well. That link in the chat box, I think we actually have put that as well in our COVID champion updates for the past few weeks. If you're a business owner, or you'd like to encourage your business to sign up, that'd be fantastic. So essentially, it would be about testing staff regularly using the LFT tests. It's just a way to keep the workplace safe, as well as the other measures such as wearing a mask, washing your hands, etc. The deadline to sign up for that, I believe, is the 31st of March. The link is in the chat. Please encourage your employer to sign up. As well as this, our testing team have also set up some training sessions for businesses as well. So if you are interested in your workplace having a rapid testing site, that's fantastic. That's amazing. If you want more information on that, join this training session, and the testing team will show you, how to operate this. I guess like that, the legal aspects as well, and just how it works. So I will share the details of that with you as well, just in case you know anybody that might be interested. I'm just looking at the last few questions in the chat box. Linda's asking, can you please confirm if a parent has a positive LFD followed by a negative PCR in the next day or two, can the children return to school?
Should we do this one as a quiz? I might have hinted the answer to that earlier. So yeah, yes is the answer. So the PCR test trumps that LFD test that you've had. That's the answer to that. I don't know if Rizwan wanted to say anything.
No, I'm
okay, brilliant. Okay, thank you.
There's a couple more questions in the chat box, but I'm conscious about time. I will get back to everybody that hasn't had their question answered. That's no problem. I don't know, Madupe, if you just want to round off by talking about what's been happening in Birmingham in terms of, I guess, the case rates in the different wards. It might also be worth, if we have time, touching on the AstraZeneca vaccine and blood clotting as well, because I know people would have seen that in the news. I guess over to you, Madupe.
Oh,
Yeah,
thank you.
sorry, I'll just quickly add. I think we got stuck straight into the meat of the chat, but I don't think you introduced yourself, Madupe. So if you just
Oh,
take a few
thanks, Jack.
seconds and let everyone know.
Well, I kind of feel I know everyone now. So I'm I've just joined the team here, the amazing team here in the council, as one of the public health consultants, and I'm going to be working with you all very closely and looking forward to meeting everyone and getting to know you more on the community communications and engagement work, as well as the education work. So working with the schools, the universities, colleges, and other places where we're educating or offering learning to people. So I'm really excited about working here. I think someone, when Rizman was talking earlier about the mosques and the churches and the work that's being done to raise awareness, I've had the privilege of joining some of those calls with the faith groups, and I've just been amazed at how much dedication and that sense of community in the cities is just phenomenal. And I think that's one thing that COVID-19 has, that's a positive side of COVID-19, that all of a sudden we value community and the unity and the need to come together and support each other. I think over the since we became a digital world, we've become so used to online, living online and doing stuff online, which is brilliant. But we kind of lost touch with our neighbors and each other as well. And the beauty of COVID is we suddenly realize that we need each other and we need to be able to support each other. And I hope that beyond COVID, I think that's what Justin would want as well. And we've talked about this a lot, that these sort of interactions and these sort of engagement work will continue. It isn't just for the pandemic. This is the future of the city, from what I understand. So I look forward to working more with everybody, and very pleased to say that the rates, the case rate, or as we call them, the numbers of people per 100,000 with COVID-19 in the city has been coming down, just as it has nationally. We know that's predominantly because of lockdown, but I think overall as well, the fact that more and more people getting the tests and isolating might be helping. So although the testing is going up as well, so between last week and this week, so up until about the 12th of March, we've more than doubled the number of people getting tested per 100,000. So about 12,412 per 100,000. So thank you all for all the work you're doing to raise awareness about testing sites and how people can access tests online and all that information. So whenever you're sharing those messages, Facebooks, and resharing those posts that Jack and everyone's putting up, it's making a difference and helping to signpost people. And we hope that the direction of travel, as we call it, the cases will continue to go down as well over time. We know that workplaces still seem to be flagging up what we call clusters. So people with infections who might not necessarily have been linked to each other, might not have caught it from each other at work. And the question earlier about LFD testing helps to buttress the point about those of us who work in offices or shops or places in the community, to encourage each other to get an LFD test. I almost feel like we need to start a slogan of some sort, but we don't want to stigmatize people and we don't want to put people under pressure. Have you had your test or something when you're turning up at work and clocking into the sheet at work? So let's keep encouraging people to get tested as well. Although we're getting lots of people tested, we can still do more. The other thing is the ventilation at work, which we mentioned earlier. I think as more people want to start to go to some kind of normal and going to work, apart from our face coverings, let's encourage, if we work in an environment where we have access to windows or doors that can be opened, especially as the weather improves, that we're able to do that if we're not able to work from home. What we'd like to be able to see is more people getting tested, perhaps up to every 3 days, at least twice a week. But we know it isn't always practical. But if you're part of a household with a child in school, you are expected to get the tests done. We have more test sites now available locally. So for people without symptoms, the links have all been put out. And if you need more information, or if you have more ideas about how we can make testing more accessible, please let us know. Keep sharing your feedback with us. The admissions in hospital as well have been going down. This is really, really great news for those families who've had loved ones in hospital. It's been very traumatizing, and the uncertainty is heartbreaking when we've been seeing on the news the photos and the videos. So we think now the numbers are about 30 new cases a day across the hospitals in the city, which is much better than what we had before. Though the pressure on the NHS is still high, it's good to see the numbers are going down. So we just need to continue to take the vaccine again, so that most people who do unfortunately have COVID will not end up in hospital. The other thing that's worth talking about is the care homes. I think again, some of us might have loved ones in care homes. We know care homes have reopened. So let's just encourage those people who perhaps are looking to visit their loved ones in care homes to ensure that they are doing so safely and following the rules in the care homes. And if there are any problems, do let us know as well. And we know we still have a couple of wards where the cases are high. We talked about inequalities earlier. About 28 wards had an increase actually in case numbers compared to like the whole city going down. So we can, I don't know, Holly, if we usually share the detail of which wards have the highest case rates, but I can say them.
Yeah, I mean, we do share the information, but if you want to share it, that's okay.
Okay, so that's fine. So the ones with with the highest case rates in the last week: Allen's Cross, Shard End, Hyters Heath, Perry Common, Oscott, Edgbaston, South Yardley, Pipe Hayes, Ward End, and King Standing. When we say highest case rates, obviously much better, lower than what we had before, but still compared to the rest of the city, these are places where we think that more people have COVID per 100,000. Do bear in mind, though, this would depend on how much testing is going on across the wards. I haven't got the data on how the testing rates compare at ward level, but these are the wards with the most cases, as we can see. And we think across the age groups, the cases are going down, although the 20 to 39-year-olds still have the largest number of cases. So we do want more champions in the younger age group to help to support them as well. I think the only other thing perhaps to mention is the ethnic groups, where again, we've seen case rates going down across the ethnic groups. We still have the largest number of people with COVID in the white ethnic group, which perhaps might also be because we have more white ethnic groups in the city than other ethnic groups. That's all apart from the vaccine and the clot situation. I'm happy to tell you what I know, mainly from reading on the press and the fantastic update Justin gave the other day at one of our faith group events. So
Madupe, yeah. I could just interject there, because I think there has been some breaking news as we've been on this call. So the EMA, so that's the European Medicines Agency, which is the regulator, after conducting its review, after 13 EU states suspended the use of it, they have said that it was not associated with the higher risk of clots, so they've concluded that.
Fantastic.
So yeah, they've
brilliant. Thank you. That's fantastic. I feel like giving them a round of applause. That's such a relief. And this is exactly what we were going to say to you, to please share. Rizwan, I can see you want to please say something.
Well, I was going to quote Shakespeare on that. Much ado about nothing, I think.
What this pandemic has definitely done is kept us all on our toes and very informed. But
I think, to be fair, though, the problem is that, like today's vaccination day, we had 50 patients booked, 35 turned up, and 15 were not sure because of the blood clot issues, but then another 15 turned up. So we got the numbers, but it's really, maybe I shouldn't say this because it's not politically correct, but to be fair, what's happened here is that it's caused unnecessary panic and concern, to be fair, in people who otherwise would have been vaccinated today. But I suppose, you know, we have to be responsible for what we sort of say in public.
Yeah, and so there's a lovely campaign, actually, the Check Before You Share campaign, which one of our local GPs is featured in. I know we've put that up, haven't we, Holly, on the web pages. Correct. And just to encourage everyone that, you know, this, what the WHO coined an infodemic, you know, is almost as bad as the COVID pandemic itself, because the way information goes out, and, you know, and as you say, much ado about nothing, people make a mountain out of a molehill, and it affects so many people's lives. So do continue to come to us if you're not sure, and do continue to share with us any myths and concerns, because we're here to do our best to work with you to get people the right information that they need to make the right choices for themselves and for our entire community.
Yeah, absolutely, and I would agree with what Julie just said in the chat, that I think we should be more worried about blood clots and the pill than blood clots and the AZ vaccine.
Well said, Julie. Thank you. That's me done.
What I'll do, so the article that Jack's shared that's literally just come out whilst we've been in this meeting, we will make sure that the research and the actual detail is put into our next newsletter. So if anybody in your community is saying, oh, I don't want to get the vaccine because, you know, it causes blood clotting, here's the link, and, you know, please do share it with them. That would be fantastic. I'll make sure that in our next newsletter that goes out as well this week, we include everything we've mentioned around LFT testing and PCR testing as well. And we are in the middle of making some resources for school staff, for parents, for young people around the testing that is going on in schools at the moment as well. We've gone about 10 minutes over, but thank you so much for staying with us. Thank you so much for joining us as well. And thank you, Madupe and Rizwan. If anyone needs anything in the meantime, please email us. You should all have the dedicated COVID Champions email. And I hope to see you next time. Thank you. Thank you very much.
Thank you. Bye-bye.
Thank you very much. Bye.
Thank you. Bye-bye.
Take care. Bye-bye.
Thank you.